Good morning, everyone. I hope everyone can hear me. Alan, are you there? Can you hear me?
Good morning, I'm here. Yes.
Great. And David Croasdale in Hong Kong, are you there?
Yes, I'm
Great.
here.
And for those of you who are with us this morning, David will be audio only. I think, David, you live in a large apartment complex, and I think you said all the kids are doing their homework and bandwidth is limited.
That's right, yeah.
So, life in the new
Yes.
times. Good morning to everybody who is on board with us here. Welcome to Tunheim and our webinar, Communication in the Time of Pandemic. I'm Pat Milan. I'm the Chief Insights Officer at Tunheim. I want to thank quite a few people who've put this together. Number one, our participants who have taken time from what is a crazy time. Alan Montrasio from Imageware in Milan and David Croasdale from Newell PR. David is in Hong Kong. The producer of this event is Josh Carter, who he and Nick Marcouillet and our staff on the digital side have done just a great job trying to pull all of this together to allow us to get some insights from the group. I know that many of you may consider Tunheim a boutique agency, and the truth is we like to think of ourselves as providing boutique experience, but the information we're able to provide this morning comes as a result of our global network. It's called IPREX, and we rely upon it on a daily basis to get local knowledge on the ground, and that's part of what you're going to see here today. We have a unique opportunity this morning to hear from communication professionals who are literally weeks ahead of where we are here. Those of us mostly on this webinar are in the States. These individuals we're going to hear from are providing professional services to clients in countries where lockdowns have been the norm for some time. They've experienced the shock and awe that many of us are going through. They have been helping clients communicate in areas where lockdowns have become the norm. And so we're going to spend some time hearing about how they have recovered, the experiments they've had with communication strategies and tactics to help clients get through what is called the new normal, and hopefully help us with our own efforts to tap into what is a very unique time and try to communicate through it. A couple of notes before we start. At Tunheim, we've been fielding quite a few calls, and the calls have been from people who are just seeking some quick advice. And we decided as a result of that, and particularly even some of the nonprofits that have come through, we have decided to open up the lines of communication at the firm. We have 15-minute blocks that we're scheduling. And if you have a question or you need some insight, there's a group of our professionals today and Friday from 11 o'clock to 1 o'clock, that's Central Standard Time. Our professional is going to hold some free of charge one-on-one meetings. You can find the place to book time on our website at tunheim.com. If you check our Facebook page, there's a link there, and you can do it on Twitter as well. So you can sign up on tunheim.com, and the links are on Twitter and Facebook. Our two panelists this morning, great insight. I've spent the last couple of days talking with Alan and David. Alan Montrasio from Imageware in Milan. Alan's got deep experience, particularly across high tech, but has also worked across consumer clients. David also at Newell PR in Hong Kong. David does technology, he does travel, tourism, has seen it all, and in about 3 decades or so of work there. I want to spend a minute, and I'll bring these guys full up onto the screen here and stop sharing that screen. And the other point I wanted to make was there is a Q&A button at the bottom of your screen, at least on the version that we've been using. There's a Q&A button at the bottom, and if you have a question, you can put it there, and then I'll try to relay that to our speakers. I'd like to say we have Chatham House rules, but it's hard to guarantee it. This is an open webinar, so please remember it's an open webinar. We don't really know exactly who's on here. We've got some pretty good insight. It feels like it's mostly clients and a number of member agencies around the country and around the world. But please remember, we're in an open forum, so take precautions there on behalf of you and your firm. I'd like to start, Alan, if you don't mind. Can you just give us a quick update on life in Milan right now? What is the new normal look and feel like in Milan and across Italy? if you could share.
Okay, thanks, Pat. Good morning to everybody. I guess it's morning for most of you. It's early afternoon here. So what's the new normal? We've been on lockdown since March the 15th. So it's quite some time. Sorry, since the week before that.
Mm-hmm.
So it's this is the second week of lockdown. However, many of us, including myself, have been taking voluntary smart working for the last 4 weeks. Schools have been closed for the last 4 weeks, and now most public exercises are closed. Just to give a perspective, we are not on curfew, so we can go out for day-by-day shopping. We are allowed to go to work for good reason. We are allowed out for good reason, which might be walking your dog. We need to exercise precaution, so always keep a distance of at least 1 meter. Avoid as much as possible leaving your home. So at the moment we are, let's say, all of us who can are working from home.
David, can you tell us the big news out of China and I think Hong Kong is that there are no new reported cases today, which is an interesting and important milestone. Tell us, I think you're a little bit ahead of where Alan is, and Alan is certainly ahead of us. What's life like in Hong Kong, and what are you hearing from Maggie Chan and the others on the mainland?
Okay. Well, we're week 8 of this, so it started just after Chinese New Year. I was actually away at that time, and I came back, and it was full on, and it was quite surprising. And what we decided fairly quickly was just to shut the office and everybody work from home as a firm. That's Hong Kong, Beijing, and Shanghai, and everybody worked from home for the next 4 weeks, 5 weeks. We reopened the office last Monday, and currently now we're working 5 days a week, but just short. We try and stagger lunch so we don't want anybody traveling at peak hours. So.
And David, you're breaking up. We knew that might happen a little bit back and forth. People can go and David's breaking up a little bit. I do know you did share with me that you're back in the office, limited basis, shorter hours, but there's a little bit of a return to something that feels like normal again.
That's right.
Okay.
And next week, sorry, Pat, I'll let you carry on.
No, go ahead. Next week, we've got you back, so I'll keep going.
Oh, next week we'll be on shortened hours again, I think, because the problem we've got now, there's no real domestic cases of occurring, but there's a lot of imported cases from people coming in from overseas, from North America and from Europe. So that's got everybody worried, and we're all worried now. So I talked to all the other PR firms here, and even some of them are talking about working back from home. So it's touch and go here, but as of now for us, we're just going to carry on shortened hours and just see how it goes.
This question is really for both of you. Maybe Alan, you could pick it up first. We're in this really interesting position. We're on the phone yesterday with clients who have things they want to announce. They want their customers and their partners to understand that they're trying to go with business as usual. We're all taking a look at things that we want to do, things we plan to do, and we're all trying to figure out, is that going to be tone deaf? What was your experience when you kind of reached a point where the cascading shock and awe of the change in life settled down and you actually were able to try and figure out a way to pivot and go back to sharing news that organizations wanted to get out that may not have had anything to do with the virus?
Okay, so first off, let me just say this. We are experiencing a slowdown, but not a shutdown in communication. So very much to your point, you need to be sensitive in avoiding tone deafness, and you need to be sensitive in avoiding triggering issues. We're trying to keep as much of a semblance of business as usual as possible, which means that making scheduled announcements is not necessarily a no-go zone. We have been doing this. We have been speaking with journalists. Like you said, Pat, my background is mainly in technology. So I do speak with technology and business media quite on a regular basis, more than any other type of media. Journalists are workers as much as we are. They need to get their job done. So they're quite happy to listen to us. What we are, of course, not able to do is face-to-face interviews, press conferences, press briefings. That doesn't happen. Announcements, fine. You need to exercise common sense, basically. So there is no one size fits all to this, but like I said, avoid using triggering words, avoid sounding tone deaf, acknowledge the fact that there is a crisis, but also it's different from traditional crisis management, and this is a global crisis. It's not just a crisis of a single company or business. Everybody's in crisis. So as much as possible, business can remain on at least, how can I say, an even flow of activities.
How long was it before you went from a very unusual situation to actually making any kind of an announcement that really had nothing to do with the virus?
I would say a couple of weeks. So from the moment we heard the first case breaking out, it was a Friday, immediately we realized that the situation was going to be critical, also because we were aware of the news of China. So over the weekend, we immediately decided that everybody should be smart working from home from the Monday. Myself, I had scheduled a meeting in Bologna. We were very quick in deciding together with our client that that was not going to happen. So let's say 2 weeks ahead of the official lockdown, we were already starting to implement smart working possibilities. And this was also true of quite a few of our clients. I have a privileged outlook because most of my clients are in technology. So most of these companies are equipped for smart working anyway. So they just implemented it as widely as possible.
And I want to come back to that in a little bit, because I think the technology clients you have were pretty smart about how they went about it. David, can you talk about that transition? I know it's been a while. I don't think you've forgotten it. When did you transition? We're hearing Alan say it was a couple of weeks, and then you were able to try and get back into some semblance of a natural cadence, even if it was around announcements or other pieces. How did that work for you in Hong Kong? And I'm wondering if Hong Kong was different from the mainland.
But about the same period, actually, Pat. Luckily for us, we had Chinese New Year, and what happens at Chinese New Year, people tend to drag their feet in going back to work. So over that sort of dragging your feet period, we had a week or so to sort of get into it. And then invariably what happened, we were just working remotely. So press releases went out on a regular basis. Interviews, we didn't do face-to-face, we just did by phone. All these press conferences have gone to a sort of, an online format. So just everything's just gone online, and everybody's happy with that. We did have a case where we were going to send some journalists to the US for a large conference in Las Vegas, and that was all going ahead for at least 3 weeks. And then all of a sudden, we started to notice in California a lot of companies were just canceling these things. And then we knew that Las Vegas event was going to be cancelled, and it was. And we just told the journalists, you can't travel. I mean, they were okay to travel, but it just didn't happen. So that's just an example of what happens. But that's on the media side, and just we are PR firms, and we're always dealing with new business inquiries. What I've noticed, a lot of the new business inquiries didn't dry up; they just kept coming. And you know, we had at least 3 a week, which we dealt with by phone calls, putting PowerPoints together at home, and then just, you know, just sending things off. None of them have actually come through in any confirmations yet, but throughout all of this, the new business has carried on. So that's why I'm fairly optimistic about things. I mean, it's not like, you know, everybody's just, you know, pulled the shutters and that's it. I mean, you know, life does go on in terms of new business and just general media work as well.
Alan, how are you advising clients on moving forward? You still have empty streets. I believe transportation is pretty much shut down, correct?
Not exactly. Local transportation is active. Intercity transportation is shut down.
But question here from Peter Mitchell, who's in the DC area. He's wondering what your projection for the longer term normal might be. What is the outlook for each of your countries 4 weeks from now?
Okay, so before I address the question, I would like to add to David's point about new business. We're experiencing very much the same in Italy. So new business opportunities are not drying up at all. We are still following through with these. Actually, ironically, I seem to be working more now that I'm at home than normally when I'm at the office. So that's a good point. Now, to your point, first, let's address the question, what is the outlook? So the first decree emanated by the Italian government was to shut down everything until April the 2nd. That will be leading on to Easter time. There is no official news yet, but the consensus is that this is going to be postponed, possibly well into April. We don't know yet. So the outlook is basically trying to equip to start seriously considering remote working and setting up any kind of infrastructure to do so. So with our business, quite a lot of it can be done remotely. Of course, what we will be missing, which is something quite big in Italy, is the the events, the physical events. Let's call them this. So that's something that we have no outlook for. Just to give you a point of view, the municipality of Milan was going to organize what we call STEM in the City. It's a long series of events, a month long. This is going online. It's going to be done on an on-demand basis, streaming. So we're looking at transferring as much as we can online. So that's the outlook at the moment.
And that was for the event STEM in the City, right?
That's right.
Yeah.
Yes.
Science, technology, it should be able to go online.
It should be able to go online, yes. And it was addressed mainly to schools. So of course, the schools being shut down, we need to do it on demand also because of that reason, not just because of the lockdown. Regarding advice, first of all, there is no one size fits all for this. And we are all in this crisis together. So my point of view is it's okay not to have an answer immediately. It's okay to set up brainstorming and consulting and speaking with the clients and then doing our research and coming back with a set of ideas to be discussed, because this is so unprecedented that it's whatever you may be prepared for. I don't think anybody was envisaging anything on this scale at all. So that would be the first point. But other than that, from an agency point of view, I think most agencies, because of the nature of our work, we are quite equipped, and possibly many people do smart working on a fairly regular basis. So that needs to be implemented throughout the company. It was easy for us. There is 50 of us. So at the beginning, we just set up a skeleton team in the agency to deal with, for example, deliveries, shippings. We do a lot of product testing. All the accounting part was, all the account management part was moved to virtual work. And we have a graphic design office At the beginning, when we were doing this voluntarily, they were actually working in the office. Then we set up home working for the graphic artists as well. So now the whole agency is working from home. We basically have an office which is an empty shell, but the business is keeping in contact virtually. So the key point here is to set up a platform that allows you to keep regular contact with your team working and with the client. So for example, a platform such as Zoom would be perfect. Microsoft Teams, Skype, whatever floats your boat, basically.
Mm-hmm. What you did mention events, and you and I talked about this earlier in the week. What's the approach now with things that you had planned as events? Are all of them potentially going online without gathering a crowd? Are you scrapping some of them? What's happening on the event side?
A bit of everything. So some are being postponed. Some events need to happen physically, so these are being postponed, and we're looking at after the summer by this point, just to play it safe. As much as possible, we'll be trying to do events online, and some just because they are time sensitive, they are linked to a certain specific moment of the year. Unfortunately, you need to scrap. So it's on a case-by-case basis here.
Is there anything in particular that just is dead and has stopped? David, jump in here whenever you're ready. I hear, Alan, you're trying to keep things going, and it seems like clients want to try and keep things going business as usual. David, what's happening on your end?
Well, stuff that's not happening, trade shows. There are no trade shows happening, and I can't see them happening for another 3 months here because, just all the logistics involved in them. I have a client regularly comes from California. Without fail, he comes twice a year for a wine show and for a food expo, and there's no way he's going to come unless things improve. And now, on a practical basis, when I say improve, what I want to see locally in Hong Kong, I want to see a week of no new cases, no new reported cases, and I haven't seen that yet. As soon as that happens, I'll be more comfortable, but it hasn't happened yet. Yeah. In China, our offices, we're in a government-owned building, and they will not let that office. They won't let more than about 30% of the total design capacity of people go in there. I want that office to go back to sort of normal, and it hasn't yet. So that's in the government's hands. That's just on a practical basis.
We had a question about video shoots, and we had a question about that yesterday. Somebody else has one planned. Are either of you doing any video shoots?
Well, at the moment, we are looking at doing something where people actually shoot themselves, sorry for the pun, with their smartphones. Mm-hmm. So we're looking at that. We are in Italy in the position of possibly being able to do this on a strictly one-to-one basis. So you can get a camera operator to move for a good reason and to do this. Mm-hmm. This is happening in studios, so this can happen. But we're trying to avoid as much as possible, and we are advising clients as much as possible just to stay put.
Can you talk about the type of business that is continuing in any of the different sectors across public relations or advertising? The question here is anything stopped just completely off the board, other than David mentioned trade shows, and certainly he's got a client from the States who probably isn't coming to Hong Kong, but what else falls into the category of that's just not going to happen anytime soon?
Events. We have a division that deals with events. Of course, that's on hold. That's on hold.
Just to remind folks who are on board, the Q&A portion is open, and if you've got a question, shoot it there because we'll get it to the gang. David, go ahead.
Pat, in Hong Kong and certainly in most places in Asia, everybody's wearing face masks. Oh.
Go ahead, David.
Hello?
Go ahead, David. A little crosstalk. That's okay.
Yeah. Yeah. Everybody's wearing face masks. So, you know, to do a video shoot or anything that involves an interaction, it's not really that practical at the moment. Everybody's trying to keep their distance from each other. So, you know, anything that involves that optics of face masks isn't going to look good in, you know, a year's time. So that's another thing I'm waiting for. You know, at some point we have to stop wearing face masks. I mean, everybody's wearing them here. 99% of people wear them. The only people who don't are foreigners, and they look a bit odd because they don't fit in. So yeah, anything where the optics is not great.
Alan, you had a comment there. We were a little bit of the cross chat there. Is there anything?
No, I just
go ahead. I think we're frozen with Alan at the moment on video. That's okay. David, if you're still there, I'm just curious, as you've got the longest experience with this in terms of months, but not necessarily just weeks. And some of us are just in the initial weeks. Do you have any sense of, you know, we go through these things and you always have long-term trends that change. Are there some things emerging that you look at this and you go, here are some things that I know probably will never be the same again? Good or bad? I'm just curious.
Well, I think everybody's touched on it. Just the way we work. I mean, at the moment, up until this all started, everybody went into the office every day and sat there and talked to each other. I can see more flexible type working coming. I don't quite know how it's going to evolve, but you know, everybody's proven that they can work from home and they can use technology to get things done. So I see more flexible working coming. Mm-hmm. As to whether that extends to actually getting rid of the office and, you know, going into like WeWork type offices, I don't know. Maybe that's something that will happen. I don't know. It's not just, you know, this business, the PR business. Everybody's got the same issues. You know, if you work for an insurance company, a bank, you know, it's opened a lot of possibilities, and I can't get a grip on it. I mean, you know, I think it'll just evolve, but we'll see.
Do either of you have any sense about what's being communicated regarding the state of healthcare workers? A lot of the people who are on this particular webinar work in the healthcare side. What's being communicated on your end about the state of communications, either to healthcare workers or about what's going on? I think Alan is frozen out right now. So why don't, David, you go ahead.
Oh, okay. Well, the healthcare system here is primarily government, so it's like a national health service, and they just, I think they're busy. You know, they've got enough on their plate. You don't hear a lot from them, apart from every day here we get an announcement of new cases. At say about 6 o'clock, there's always an announcement. So today it was 20 new cases. And I just think they've got their hands full with dealing with this. I don't think it's the time to go talking about new drugs and things like that with them, because they're just busy.
Got a question from Karen Johnson. She's saying, asking, as the cases diminish, David, this is probably a little more in your side. What do you think will be important for city governments to do or say to bring back confidence to start the recovery process? And I know you walked through a couple things, David, and you said, well, there are some things you want to see. But and Hong Kong is such a unique place, but it would really be interesting to hear what you think the city or local governments need to do to try and help bring back confidence.
Right. Well, we've been through this before, actually, in Hong Kong, because we had SARS in 2003. So we had pretty much the same situation, although this one's a lot worse. And at that time, they decided to have just promotions to sort of promote the location. In fact, I remember very distinctly, they had a big rock concert and got all these bands in. The Rolling Stones came, and everybody just to sort of show that it was all back to normal. So those sort of big statement events, Hong Kong can certainly do, because the government's got lots and lots of money to spend on these sorts of things. So yeah, those big statement types events are important, and also they'll spend money on advertisements in the Wall Street Journal, New York Times, those types of publications. They're good at spending money. Yeah.
Hey, Alan, I think we've got you back. We froze up there for a little bit.
Here, yeah.
Yeah. Is there anything, you're really at the height of this right now, and I have the sense that you're a couple of weeks ahead of us in the States. Megan's asking if you're seeing anything in the news other than virus-related updates, and I think what she's really getting at is, are journalists interested in starting to cover healthcare or other stories that bring life back to some sort of normal outside of COVID-19? Is there anything being covered other than the virus? Do journalists have an interest?
Yes. So predictably, the main topic in the news is the virus. But yes, there is other coverage happening, especially in the specialized sections of the newspapers. So it's dealing with technology. We're seeing. I'm not saying business as usual, but we are seeing journalists who want to collect information, to write.
We're having some difficulty there, and I apologize. Bandwidth is really stretched everywhere. Oh, there you're back, Alan. Go ahead.
Perspective here. Okay, I'm back. So I was saying, for example, talking about healthcare, we're really noticing a big cultural difference from China and Hong Kong. One thing, we are a nation of very health conscious people. We are very, very careful. We have a much higher life expectancy than most even Western countries because of this. So we are always careful about healthcare. And we have, in spite of some limitations, we have a very efficient national health service. So a lot is being reported about this. It's interesting
but on the health stuff, is it all around COVID-19, or are you getting other stories about healthcare that aren't necessarily just virus oriented?
Well, we're getting stories about other topics. Of course, COVID-19 is prominent, but it's also, I think there is a feeling in people, they just want to hear different news. It's kind of becoming depressing to hear about that. But for example, even in technology, there are interesting cases which are related. But for example, there is a company in northern Italy which is 3D printing valves for respirators. So yes, it's related to COVID-19, but it's not about the outbreak. It's about, an outlook on what can be done to address the situation. So there are many stories this way.
David, question for you. You did mention, I know that the big food and wine show, I think it's coming up, and I'm guessing it's not going to happen. And you work in both the food and hospitality has been a big industry for your office, particularly in Hong Kong. Beyond the show being canceled, can you talk about issues with supply chain? How are your food or hospitality clients navigating this, and what are you communicating on their behalf, or what are they doing? What's being done well?
Yeah, the supply chain stories actually come up quite a lot, and a lot of it's supply chains from China to the US and Europe, and that's not just, it's just regular consumer electronics. On the food side, there's never been a problem with getting food into Hong Kong. I mean, it just comes in. We've had issues with shortages, as everybody's sort of experiencing now. But fresh food and that, fresh food products, food, wine, things like that, there's never been an issue of things coming in. The biggest problem is that there's no demand, because Hong Kong, a lot of the demand is from the tourist trade, and there are no tourists now. So all the hotels, all the restaurants are really suffering badly. And, until those tourists return, and what I suspect is that our big brother on the mainland will basically send a load of tourists here at some point, and then everything will get back to normal.
I have a question from Thomas Soliday. He says, nearly all the companies here, and this is true, everyone's issued a press release about COVID-19 and the state of their business. He wants to know, how can I communicate my company's concern and caution over the situation and not sound like a broken record? Alan, you and I talked about this a little bit yesterday, that the creativity starts to come into play. I'm hoping Alan is not frozen there, and he is. So David, you want to take a shot at that? How do you get beyond that basic release and use any? Oh, there's Alan.
Fluid.
There you go.
Here I am. Okay.
Yes.
So what we're looking at here is none of my clients has issued press releases per se saying.
We've lost Alan for a little bit, so we'll come back to that. David, how do you go about doing this in a way that shows some level of creativity and can actually create some interest?
What I have.
Hi, Pat.
Yep, go ahead, David.
Yeah, okay. We've got clients that are obviously trying to get some sort of message across. And I mean, an interesting one, at the moment, all the schools here are closed, and they'll be closed until the 20th of April. So we have a large software client that's basically saying, and I'm sure other people are doing this, but our software is available free to people who work from home. So up until, sort of middle of the year, you can use their software for free at home. And then we've had others in the security software business who basically saying the same thing, that we can help you work securely at home, because obviously if you're working at home, you're open to more online attacks from people as well. So yeah, in some ways we rely on the clients to give us the raw material, and then we sort of just put it out there as press releases or online interviews.
Alan, I think we got you back. How far behind do you think the U.S., based on what you've seen with what's happening in Italy? Chris Brown's asking the question: how far behind Italy and China do you think the U.S. is on track of this disease? You're going through it.
For Italy, I would say the U.S. is probably 10 to 15 days behind.
We're really struggling with Alan's bandwidth. David, what do you think? The question is, how far behind China do you think the U.S. is on the track with the disease? 10 days to 2 weeks
behind.
Okay, there we go. 10 days to 2 weeks from Italy. Thank you, Alan. We're struggling to hear you. It's going back and forth. David, what are your thoughts as you watch?
I'm coming back delayed by the listener.
Sorry.
Hi, Pat.
Yep.
Yeah. Well, as I said, I'm week 8 into this, and I watched the TV with President Trump, and they're slowly starting to get the severity of it all. So I think, as Alan said, I think about 2 weeks behind Italy.
Talk about the ability and the importance of social and digital through all of this. It feels to me like you've got to be making leaps and bounds in that. I know Hong Kong's been social and digital is just part of everyday life. It's not even considered a separate thing. But how critical has that been to engage now that we can't do events, we can't do any kind of gathering? So are you seeing any change, or is it just more of social and digital implementation?
Yeah, is that to me, Pat?
Yeah, go ahead, David. We're turning off Alan's video to think it'll help the bandwidth. Yeah.
I think it's more of the same on the social side, but what we're seeing is certainly more Zoom type stuff. I mean, everybody's using Zoom. So Zoom press conferences are important, or if there's another equivalent of that, like Blue Jeans or whatever. But the social side is just it carries on as before. I haven't seen a noticeable uptick in that area. It's just switching from physical into sort of specialized, more professional level platforms like Zoom.
Alan, are you hearing us a little better now that you've turned off the video?
I can hear you, yes. I turned off the video. To David's point, I think from the social media point of view, yes, it's everything is happening as usual. We haven't so far done press events on platforms, but for sure I can see this happening pretty soon. And this is more or less what's going on. What I wanted to point out was when we were talking about the advancement of what's certainly not. We're in the full of it. So there is a strong sense of
Well, we're really struggling, Alan. And Alan, we're struggling to hear you. We're gonna.
So there is a point where we are all saying, when this is over, everything is going to resume, and the things go.
I'm going to go ahead. Alan's really struggling, and we knew this might happen with what's going on with broadband. Hey, David, quick question for you. This comes from Megan. She says, what resources from healthcare companies, we're thinking here in the US, there's so much in-home care. Are people afraid of allowing healthcare workers into their homes? Have you seen anything in that area at all?
Well, culturally in Hong Kong, healthcare workers do not come to your home. You go and see them. So there's like a family doctor, you go and see him. If it's more serious as a hospital, you go and see them. But the way it is at the moment, everybody will keep as far away from hospitals as possible, even if they've got gangrene or whatever. So culturally, it's not equivalent really. People don't go into people's homes.
So you don't see that it's really not relevant. We're about at the 45-minute mark here, and we've had our struggles, and I suspect bandwidth continues to struggle. I want to thank the two of you for helping us understand kind of where it is and some better understanding of where this is going. I think the biggest takeaway is, particularly here in the States, we've got about a 2-week period before we can any sense of normalcy with communicating, but we can use that time to start thinking about how to be more creative, how to deploy our social and digital services to get to it, and start to find ways to better communicate the other things that are part of life that are getting completely obliterated right now as we just kind of deal with the cascade of shocking and somewhat awe-inspiring news that's happening across the country. Alan, thank you. We'll be in touch with you soon, and stay in touch. And David, thank you so much for your insight. A reminder that if you have a question for at Tunheim, we've got our phones open. You can go to the website and you can request a time between 11 and 1 today, or again on Friday. Based on demand, we'll see if we continue to do that next week, but we're certainly happy to put very experienced professionals on the phone with you to answer any questions you may have. And we'll continue to monitor this with our partner offices who are ahead of us on the curve and experimenting with what's going on. I will share, I was going to ask Alan this question, and because we lost him, I'll just answer it. I did ask him if he had known before all of this has happened, was there anything he would have done differently? And he did say, I would have gotten a haircut and I would have bought a dog. And the dog he mentioned early on was because it's one of those reasons you can actually be outside more often in Milan. Again, we're here at tunheim.com. I'm Pat Milan. I want to thank Josh Carter. I want to thank Lexi Sundberg for help all to put together. Nick Marcouillet, who helped put this webinar together. We had technical issues, but that had nothing to do with the team. It's just bandwidth issues in Hong Kong and in Milan, and that we knew was a potential, but we hope you found it valuable. We are here for you. Give us a shout. Let us know how you're doing, and we'll be in touch. Thanks so much for joining us. I'm Pat Milan signing off from Tunheim in Minneapolis.